Good evening, friends. Today we are going to talk about a very important modality which has come a long way in critical care and known by the name of ECMO. ECMO is basically extracorporeal membrane oxygenation. Extracorporeal means it's outside the body. Oxygenation means it's a machine, it's a modality which gives oxygenation. So that's why the full term is known as extracorporeal membrane oxygenation. What is ECMO? A lot of people would have heard about ECMO in the last 2 years, particularly in patients with lung failure when the COVID pandemic had hit us last 2 years. ECMO became very popular during H1N1 epidemic way back in 2009, and since then, this modality has gone a long way in saving lives of patients with lung failure. Where can ECMO be used? ECMO can basically be used in all those patients where a patient is suffering from respiratory failure, which is not responsive to conventional therapy. Conventional therapy means we have given oxygen, we have applied non invasive ventilation, we have put the patient on ventilator, and even after that, if the patient's oxygenation or oxygen levels are not improving or are going down, we actually are able to save patient's oxygen levels and his life by using this modality. What it does is that it's another mode of way of oxygenating the lungs and giving oxygen to the other parts of the body. So practically any disease where the patient has lung failure but it is reversible. Reversible means it can be treated. And when the patient is not responding to conventional therapy, can actually be treated with ECMO. For example, you must have heard about COVID pneumonia. We have done a lot of patients of COVID pneumonia with ECMO with good outcomes. Similarly, patients with ARDS, patients with trauma, patients of asthma, patients of other kind of vasculitic disease which are involved in the lungs can all be saved with this machine if their oxygenation failure is happening on ventilator. Similarly, ECMO can also be used for patients with heart failure. How? This machine has two ways of supporting. If used in a particular way, it supports the lungs, and if used in another way, which is known as veno-arterial ECMO, it supports the heart. Suppose a patient has a heart attack, the first thing that needs to be done is to actually open the arteries of the heart, which is normally done by angioplasty or by putting a stent in the heart vessels. Now, after the angioplasty or after the stent, if the patient's blood pressure is going down, and in spite of conventional treatment, if the heart failure of the patient is worsening, we can actually save these patients also with ECMO. So let's take an example. Young patients, we are seeing a lot of deaths because of cardiac disease in the last 6 months. So 40, 50, 60-year-old patients who are having heart attacks, but the heart pumping is inadequate. If we apply this machine supports the heart for a certain number of days. And once the effect of the heart attack goes off and stent has been inserted, the ejection fraction of the heart or the pumping improves, this machine can be taken off. So that is why you must understand that the most important thing that this machine does is not only support patients with lung failure, but also supports patients with heart failure. The other area where this machine has been of immense help is patients with obstetric patients, patients with trauma, patients with those who have post liver lung transplant or post heart transplant, and also patients who have heart which is involved by viral infections. So practically any kind of lung failure or heart failure which is not responding to conventional therapy can be treated with the ECMO machine. Now there are multiple types of ECMO therapies which can be done, but the main two therapies are VV ECMO, which is known as venous ECMO, that we apply mainly for lung failure, and the other modality that we do is veno-arterial ECMO, which is basically for patients with heart failure. So it's very important to demarcate what kind of ECMO will be used for what kind of scenarios. Similarly, ECMO has been of great help in patients with poisonings. For example, patients are on cardiac medications, and these patients may inadvertently take an overdose. If one takes an overdose of heart medication, it can severely depress the heart, decrease the blood pressure, and end patient ends in a multi-organ damage. Similarly, ECMO machine can be used to support the heart for those few days when the effect of the drug goes off, and after that the patients can recover. A lot of data has been generated from our group in India on ECMO and sulfos. Sulfos is a rat killer or a rat poison which is commonly used in granaries or grain areas in the northern part of the country. If you take sulfos 0.5 gram, smallest dose, even that is good enough to cause severe damage to the heart, and 90% of the patients don't survive in the next 24 hours. If you put these patients on ECMO, within 8 hours or within 8 to 10 hours, the disease which has a 90% death rate, we can actually save 80 to 90% of the patients. In 2014, we started our ECMO program, and we have been the pioneers in this modality in northern part of the country. We have experience of all kind of ECMO scenarios, be it poisonings, trauma, lung failure, heart failure, and other kind of situations. Now, there are certain diseases where ECMO can also be used, although it's not proven that it is effective, like tropical illness. We are in a dengue season now. We are at this point of time, we have H1N1 in the society. We have COVID patients also, but there are tropical illnesses where ECMO has not been proven. But in India, we have used it, and we have found that it can be of great help. So, my dear friends, today's Facebook Live discussion was actually on a topic which is very less known to the community, which is very less known to the doctors. And as a critical care physician, it is our responsibility to create awareness about these newer modalities which are coming a long way in saving the lives of the patients. With that, I end my deliberation. If there are any comments, questions, queries, I shall be happy to take them on. Thank you.